Hello and welcome to the Dizziness and Balance video series by the Ear and Balance Institute. I am your host, Dr. Gerard Gianoli, and I am a board-certified neuro-otologist. Neuro-otology is the medical specialty that deals with inner ear dizziness and balance disorders. This video series is intended to be educational and not intended to be medical advice. For individual medical advice, please speak with your own physician. For this video, we are going to talk about the balance reflexes from your inner ear. These reflexes, when stimulated abnormally, will cause the major symptoms of the inner ear balance disorders, besides the nonspecific symptoms of imbalance and unsteadiness. There are a lot of reflexes from your inner ear balance sensors, but they can be grouped into four big categories. The first of these is the vestibular ocular reflex. This is a reflex from the sensors in your inner ear to the muscles that control eye movement. Basically, every time you move your head or tilt your head one way or the other, the balance sensors recognize this movement or change in position and will send a reflex to the muscles that coordinate the eye movement with your head movement. In essence, if you didn't have this reflex, every time you'd move your head, the world would be a blur. You'd have to hold your head perfectly still to get nice, sharp, clear vision. However, if these reflexes get abnormally stimulated, your eyes will move abnormally. The most provocative type of movement is something we call nystagmus, where the eyes will jerk quickly in one direction and slowly move back in another. To the patient, this quick jerking back and forth gives the hallucination that things are spinning. We call that spinning vertigo. That's a very specific term in neuro-otology as opposed to the term dizziness, which is more vague. There are other abnormal reflexes that when stimulated, you can get double vision or blurred vision, but the most prominent one that really locks the problem into the inner ear is vertigo, or the symptom of nystagmus. The second reflex we'd like to talk about is the vestibular colic reflex. This is a reflex from your inner ears to the muscles in the back of your neck. If you ever look at dogs or cats that have lost balance function on one side, they will tilt their head over. It's called the head tilt reaction. It's well described in animals. Now, we don't see that in people. However, in people, you'll get this abnormal stimulation of the muscles in the back of the neck where they attach to the skull, and they'll get pain and discomfort there from the muscle spasm. They'll go get massage therapy or go to the chiropractor, which will help, but it's a temporary benefit because you've still got that abnormal stimulation that provokes it. The third group of reflexes are the vestibulospinal reflexes. These are reflexes from your inner ear to all of your postural muscles that keep you upright. Again, if you see a dog or a cat that's lost balance function on one side, they'll walk around in circles. It's very typical for animals to do that. Again, people don't do that. People will see where they're going. They'll correct their line of trajectory. But what patients will tell me is they'll feel like they're tilting to one side, or they feel like people think they look like they're drunk because they keep wobbling over to one side. However, there's a physical exam test that we do called the Fukuda test. In this test, the patient will either close their eyes or they'll wear a blindfold and march in place. If the patient has abnormal or loss of balance function on one side, they will slowly rotate over to that side. The last group of reflexes are the vestibulosympathetic reflexes. This is a reflex from your inner ear to the sympathetic division of the autonomic nervous system. The sympathetic nervous system is that fight or flight system that so many people talk about, that need to get yourself ready to run away from a predator or be ready to fight. There's a whole bunch of different reflexes we see from this, but by far and away the most common one is nausea. We can also see diffuse sweating. You can see the heart rate go up. You can see blood pressure increase, or in some cases decrease. And you can also see the adrenal glands dump out a bunch of adrenaline, which will cause either anxiety or frank panic attacks. As a matter of fact, if you look in the DSM-5 manual, which is the psychiatrist's manual for diagnoses, and look up panic attacks, there are 13 different criteria that you can see with a panic attack, and you only need 4 of those to be able to make the diagnosis of a panic disorder. 8 or 9 of those will happen routinely with a vertigo spell. So it's not that unusual for someone to have a vertigo spell and then be diagnosed as having a panic attack. The last symptom I'm going to talk about is not so much a reflex, but an override of reflex, and it's brain fog. As we mentioned, all these reflexes, they're all happening at the brainstem level. We don't have to think about the balance reflexes to keep ourselves upright, unless they're giving us abnormal stimulation. Then the brain has to override these reflexes to keep us upright, and that's a big priority for the body. When this happens, we're using up some of our cognitive ability to maintain our balance. And when we're using up some of our cognitive ability, it's cognitive ability we can't use for other things, like remember your grocery list or directions to your friend's house. So you're using up, we all have a finite amount of cognitive capacity, and we're using up some of it for keeping ourselves upright. So consequently, there are some cognitive symptoms, and those are typically short-term memory problems, ability to focus, and ability to concentrate. There's a Nobel Prize-winning economist by the name of Daniel Kahneman who put out a book not too long ago by the name of Thinking Fast and Thinking Slow. And in that book, he describes how someone's driving to a place they've never been before, and they're following directions. And this is the time before GPS where you actually had to follow directions. And he talks about what is the first thing that someone does when they turn onto that last street and they have to start looking for the house numbers. The first thing that almost everybody does is turn off the radio. The reason for that is because the radio is taking up some of your cognitive capacity, and turning it off allows you to focus on looking for those numbers. So in essence, patients with chronic vestibular disorders have a radio playing in their head that they can't turn off. The good news is that does get better when the vestibular disorder is resolved. So the abnormal stimulation of these inner ear reflexes is what causes the variety of symptoms seen with inner ear disorders. Keep in mind that not everyone will notice all of these symptoms. We look different on the outside, we look different on the inside, and we are all neurologically hooked up differently. Consequently, most patients do not experience all of these symptoms, but only some of them. So there are a variety of symptoms that can be seen with inner ear balance disorders, which make it hard for clinicians to identify patients with inner ear disorders. For more information about specific inner ear disorders, check out our other educational videos. Thank you.